with me in the studio, I'm absolutely honored to introduce the former Minister of Health, His Excellency Dr. Ahmed Al Saidi. Thank you so much for being a part of this.
Good morning, Abdullah. Thank you very much, and I'm delighted to be here today, and I've been looking forward to have this conversation with you at Oman FM.
So it's been 6 months since your retirement. How have you been spending it?
This is a very good question, and life is a journey. And for me, retirement honestly is a blessing. I've realized that being a minister, serving the country, the community for over 12 years was a privilege, but also a huge responsibility. And it is a relief, honestly, when you know that you are free to wake up whenever you want, even though after so many sleepless days and nights, or years actually, my sleep still unfortunately not as healthy as it should be. And also, I strongly believe that the organization does not depend on one person. A Minister of Health is a system, there's a structure, and I had an excellent team. And His Excellency, the new minister, of course, he is not stranger to the organization. So I felt, when I left, I felt that I'm happy. I've achieved something, I hope. But also, I'm satisfied that those who were the ministry and those who came to the ministry, they will continue the journey, and they will continue to serve Oman and the population in Oman the best available healthcare services and with whatever facilities we have.
You've spent 12 years in the service of this country as a minister. I would say 6 months is hardly a break. What brings you back to the public?
I've never left the public. I think one of the secrets, or one of my secrets, has been in the public eyes. You never keep away from them. I'm glad in a way that my lifestyle has not changed. When I was a minister, I was the same as when I was a doctor at the Royal Hospital. And when I left, I didn't feel there's something strange. I didn't feel that something is missing. There was no gaps in my life. I continued to, I had luckily more time to spend with the family, to visit friends, to travel. I've been to few countries since the retirement. And coming back here, it was you're persistent, thank you very much. And I don't mind always to contribute to anything that will shed the light on the healthcare services in Oman. I don't mind doing anything if that's going to be inspiring the younger generation to go towards specialties, and I'm not talking about medicine only, that the country needs, that they will serve the country in so many different fields that we are desperate for. So anything for inspiration, anything to also, I've been in international conferences since the retirement, and I insist in wearing the Omani outfit. People know me, I'm from Oman, but I need to promote Oman. I feel that I want to promote Oman, and luckily, the image of Oman, or the name of Oman in healthcare, I had a group of friends yesterday from Netherlands and other European countries, and Oman name in the WHO, World Health Organization, and other international health organizations, luckily at the top. And that didn't come easily, and didn't come by my work personally only. It's a team. It's the support of His Majesty's government as well. So coming back is a revisit to remind people about the importance of health, about also how you could, from a small village, end up, if you work hard, and hard work never killed, you can reach places. Not necessarily become a minister. That's not, I don't think, and please, for the younger generation, that should not be the aim of all of us. The aim is to serve your country at the best way and in any field that you can. And I always remind people with J.F. Kennedy's quote, don't ask your country what your country can do for you, but ask what I can do for my country.
Absolutely.
And I think we need that in Oman.
This is Oman FM.
In March 2020, the world went through, it was flipped upside down, a global pandemic. And you suddenly were in the forefront of everything here in the country. You were the voice of reason, the voice of guidance. People were looking at you to know what's happening and to what to do next. And prior to that, we have not seen a minister come to the public on a weekly basis on a conference. If I'm not mistaken, you're the first one in the history of this country who has done that. Could you walk me through that decision process?
Well, let me take you back to the 24th of February 2020. That is, unfortunately, when we recorded the first 2 confirmed cases of COVID-19 in Oman. 2 Omanis who came back from Iran, and they were tested positive. Of course, luckily for us in Oman, we have an excellent surveillance team at the Ministry of Health, and we were following what's happening in China and worldwide. And we held the first meeting about the pandemic weeks before WHO announced it as a pandemic at the Ministry of Health, and we activated our plans. Of course, it was not announced, but we knew that we have to be ready. So on 24th of February, we confirmed the first 2 cases, and of course, as any other countries, the numbers started to escalate. Initially, the responsibility of running the show was at the shoulders of the Minister of Health. And that's now normal, that's natural.
Did you realize the gravity of the situation yet?
Not really. And I am not shy to admit some of the mistakes that I've done personally. In the first interview, before we had the cases, everybody was saying it's just similar to the normal flu or seasonal flu, and I fell in that trap initially. But of course, the good thing is you have to change your course when you know that you are not going in the right path. So we recorded the first 2 cases, and the numbers started to escalate. And after a few weeks, and after realization from my technical team, from the experts, that this is going to be a pandemic, this is going to be more than the Ministry of Health itself can handle. His Majesty formed the Supreme Committee, which you all know about, and I think that was one of the best things that's been the step that taken initially. You need all the stakeholders to be part of managing this pandemic. You need to involve everybody, and I regret we didn't involve some sectors up till today from this in the society, but of course it's a learning curve, and as I said, it was a new thing to deal with, not only in Oman, worldwide. And initially there was interviews, news bulletins, but I thought that's not enough. During crisis, what the public need is right information at the right time, to the right persons, to all the stakeholders, so that you hopefully do the right thing, firstly. Secondly, there's something which I personally very strongly believe in, and I know our government, the previous Sultan Rahmatullah Ali, and His Majesty Sultan Haytham Allah Yahfadhum, they strongly believe in transparency. So I put myself on the line, and we decided that there will be, as a Supreme Committee, a press conference. We have not actually taken a decision whether to make it weekly, twice a week, once a month. It was left for us to decide the need for it. And in the initial stages, the need was very, very high.
Yeah.
So the press conference, as you said, was definitely the first in Oman's history that a person in the government goes to a hall somewhere and there are screens around him with journalists, because, of course, keeping our distance. And it was open-ended as well. We never put a time for it. We know that we start after the 11 o'clock news, but we gave the journalists and even the public through Twitter a space and to take their time to ask any question they wanted to ask.
Right.
And it was not without risks.
That was brave.
Especially it was live.
Yeah, exactly. I mean, as this thing was unfolding and there's gap of information, obviously, the risk is to be asked a question or where you don't have an answer, or to be put in a spot that is uncomfortable. But you went ahead with it. After the first one, what did you think of it?
Well, I think so. There's so many lessons I personally learned, and I think many people learned from Corona. To start with the technical answers, I always had my technical team with me, and I'm grateful to them. They were wonderful. What is unfortunately one of the problems we have in Oman, in the third world countries, and some people will not like this, but one of the problems, unfortunately, we don't feel comfortable to say, I don't know. We don't.
Yeah.
But I said several times, I don't know. This was it's still a dynamic situation. It's a pandemic. I don't know how this virus is going to behave tomorrow. I don't know how it's going to behave after 6 months. The main thing, yes, you don't know, but the public have the right to tell them what you know and to act according to the information available to you at that time. If I waited for 100% information to make a decision, you make no decision.
Yeah, we would never.
So
do
we were
anything.
taking decisions according to the available information at that time. Did we get them all right? I don't think so, but we get the majority of them right, and I think that's what matters. But yes, it was risky. There were a few embarrassing moments. They were very stressful. One of the press conferences that I will never forget is when I took one of my team with me, one of my staff, who had corona and spent 6 weeks in ICU and alhamdulillah recovered, but that was very, very stressful and very emotional. Is that a risk? Depends how the public look at it. I don't think ministers or officials they can or they should detach their emotions from their work, because I believe strongly that if you talk to the people from the heart, and if you talk the way you talk to your family, to your friends, you'll gain their trust. And gaining the trust is very difficult. Losing it is very easy. Gaining it is very difficult. And I think the press conferences served us as a government a lot. The social media or the rumors, the misinformation were all over the world, not only in Oman. And unless the public hear the information directly from the right sources, from the correct sources, they will follow the rumors. And countries, not only Oman, suffered a lot from misinformation.
Yeah.
And unfortunately, that is still happening about so many issues.
Even developed countries.
Of course, yeah, worse actually. Developed countries suffered from it worse. And I think after the second or third press conferences, things went probably smoothly in a way. People ask me, how do you prepare to the press conference? The only preparation, the morning before I went to the press conference, the only preparation, I got the right numbers from my team. I said, I want the latest number of confirmed cases, admission, death, and recovery. And when we started vaccinating people, the number of people vaccinated, that's the only preparation.
Really?
That's the only piece of paper in front of me is number.
And the rest is all you're riffing. It's all off the dome.
The rest is like the pandemic. It's not predictable, so I could not predict what the questions. The questions were not sent previously,
Right.
and we're going to ask you about this or that. And I think that's what makes it sort of, you get the credibility, or you get people to trust you because you are talking from your heart. And again, I repeat, and for the younger generation, please do not shy to say, I don't know, but I'll look it up. I don't have the information this minute, but I'll get back to you when I have the information. And that's what we did. Sometimes questions were difficult even for my technical team. And then the next day there was a press release from the ministry clarifying whatever we could not clarify in the press conference. And I hope actually the press conferences, I'm not saying that they should be regular unless there is something require that. But I think the public actually, they want to listen to officials, and they want to hear it directly from them. And we need to utilize all forms of media especially with our younger generation.
Your Excellency, I remember looking at you every week in the conferences and thinking to myself, like putting myself in your shoes, the burden of the health of an entire nation was on you. Everyone was looking at you. From a human level, what does that do to you?
Well, I think also being a physician, being a doctor, your life is not, there's no life free of stresses, but there are levels of stress. And I said to you initially that life is a journey. And in this journey, unless you feel the pain and unless you become deprived sometimes of things, I don't think you'll enjoy. When you have the pain, and when the pain is relieved, you feel that enjoyment that you would not have felt if you didn't know how the pain felt.
Right.
The same with the stress, but also the stress as being a minister of health. You know that stress worth it because you are trying to save as many lives as possible. But there were so many sleepless nights, and one of the worst, I've mentioned one of the most difficult press conferences, but one of the most stressful night I had, there's so many of them. When the pandemic started, we had in the country 156 intensive care beds only for the whole country. And we knew that's not going to be enough, judging by what's happening in other countries. And also there is one commitment that I personally made, and of course with the support of His Majesty and his government, we will hopefully never end up like many countries which were advanced and they were spending a lot of money on health, where their ICU beds were full, and let's say they had 2 patients in the emergency department. One is 71, one is 70. The doctor had to make the decision. Am I going to admit the 71 or 70? No, you are 71, you go home and die. You are 70, we'll admit you. So one of the stressful or sleepless nights I had a phone call, I think about 10 o'clock, that we had, and this is the peak, the second or the third peak, I don't remember, but we had 548 patients in the intensive care. Our capacity at that time was 550. So we had 2 ICU beds in the whole country. And luckily, that was the top of the peak, and these 2 beds were not needed. Otherwise, because you feel responsible if anything happened, even though, if let's say the resources are limited, things beyond your control, but still you cannot escape your responsibility and your feeling that I could have done better. So the expansion in intensive care beds from 156 to 550, which was done with limited resources, may I say, I always, in every occasion, I give my thank and gratitude to the healthcare professionals. And please, I'm saying professionals. It's not the doctors and nurses and not the Ministry of Health. We worked as a team. And the engineers, the IT, everybody. And of course, the media were with us. But to expand the number in that period of time, for me, that was a miracle. Building a field hospital, converting the old airport, and it took us only 2 months to do it. So there are lots of lessons we learned and we should actually implement from Corona. It was not all bad. It was very bad, but there were less. With every challenge or difficulty, there are lessons. The problem, we don't learn from our lessons, unfortunately.
You mentioned something quite interesting, and maybe this is a sidetrack a little bit. If you have a 70-year-old and a 71-year-old, now you're faced with an ethical conundrum, right? And I think these questions were explored during World War I, World War II, when they had limited beds and a lot of people coming in for treatment. They had to decide, who are we going to choose? We can't help everybody. We can't airlift everybody to safety. Did you find yourself facing these ethical questions?
Well, luckily we didn't reach that stage, but it's always...
It was close.
It's always at the back of your mind. And of course the decision will be made by the clinicians on the site, but that burden on them adds burden on you as being in charge. And there are so many things my team, or my ex-team, I say, went through, which are beyond, honestly, human capacity. But they did it, and they did it well. Like the anesthetist. Before a patient get sedated and put on ventilators, the last person talking to them is the anesthetist. And that anesthetist might be the last voice they hear. Because ICU, whether it is corona or any other diseases, it's intensive care as it's called, but many patients unfortunately don't make it out of ICU. And that doctor, and that's why I think something that we are not doing very well in healthcare, not in Oman only, worldwide, the mental health, whether for the public or for our staff. And we did manage to get counseling for our staff, but not enough. So the stress and the decisions that had to be made are huge, but alhamdulillah, and this is بتوفيقنا سبحانه وتعالى firstly, secondly the hard work of everybody in the country. We were not luckily put in a position where we have to make a decision who should survive, the 75 or the 76 person, who should survive, the one who is in Salalah or the one who is in Musandam.
Right.
We covered the whole country, and we worked as a team. All the healthcare sector, the government healthcare sector, plus the private sector, which I'm grateful to them. They were partners and they worked with us, which is the first. So lesson number one from Corona for me, say no, or I don't know when you don't know. Work together as a team. And that's what we did. We worked together as a team in healthcare, plus the other sectors. Corona was not affecting the health sector only, it was affecting everybody. And one of the issues with Corona, it also told us, those of us who did not believe the importance of health, that without health there's no economy, there's no education, there's no life. But on the other hand, and that's why I was in the Supreme Committee probably at the middle between my team, who want everything, which is their right, to protect health and health facilities, and the others, like the other ministers who are in charge of economy, so I was at the middle, because also I know without economy there will not be health.
In that case, you're the perfect person to ask about that fine balance between public health and a country's economy, because we saw that play out through COVID. Every once in a while, a lockdown would happen, but then a relief period would happen to stimulate the economy. And we can't deny that without the economy functioning, our country won't do so well. It will affect every aspect of it. So how do you find that balance between the two?
I'm grateful to all my colleagues in the Supreme Committee, and of course His Majesty Allah Yahfadhu, he chaired the Supreme Committee several times, and the chairman Maali Sayyid Hamoud bin Faisal, the Minister of Interior. We were given enough space, and it was honestly very democratic to discuss the issues, and we reached consensus most of the time about decisions. It's not what the Minister of Health wanted, but also not what the other sides wanted. It is what is best for the country. And there was always a middle ground. And I think it was, again, another learning, another school of honestly learning about leadership, about how to take decisions. And there are moments when I disagreed a lot with almost all of them. And
I would assume there's a lot of parties involved, a lot of different perspectives.
Of course. And as I said, the technical teams, their role was to give us the information. And sometimes they were pressurizing the person who was representing health and to go with basically the most strict version of lockdown. But on the other hand, like you said a minute ago, that without the economy, the country would have suffered, especially, unfortunately, this pandemic came during financial crisis. The oil prices, all of us remember how terrible it was. So it was a double hit, bad hit for not only Oman, the whole world. And that's why I think we were at the middle. There are countries which looked themselves up for months and months. Yes, they avoided the first wave, but unfortunately when they opened up, I'm not going to mention countries, but when they opened up, they actually were worst off. So I think, and I leave it for others to judge, I think in Oman we were in the middle. We were not strict either way, And for me, I think that was the recipe for success. And we lost lives, unfortunately, but so did the countries which were very strict, and some of them lost more lives. But on the other hand, businesses, yes, they did suffer, but not as much as countries bigger than us. Their economy is bigger than ours, but they suffered more. So, alhamdulillah, I think we were at the, as Oman's politics always neutral and always balanced. I think that the decisions of the Supreme Committee, and of course I'm biased because I was a member of the Supreme Committee, but the feedback I had from the public and internationally, that was the sort of the feedback I had, that you were the middle, you were not strict either way. And again, I have to go and repeat that it was a learning curve for everybody.
Yeah. I noticed, even in the course of this interview and as well in the past, that you keep repeating the fact that I've not always gotten it right. And that is a very fair assessment of the situation. How can you always get it right when information is very limited? Are there moments that stick out to you in particular where you felt like, I didn't get this one?
I think it was not a press conference. I've mentioned it already. My first appearance when the cases started in China and I think few other countries. I regret that interview, and I'll regret it for a long time. But apart from that, what we didn't get right, or it's at least in my own personal view, I think we should have involved Majlis al-Dawla and Majlis Shura, the Shura Council and the Dawla Council from the beginning, because we should have had the help from every person in the country. We did involve the public, and that was for me great. But these two organizations, they are part of our structure, and that was not because we didn't want to, because it was an oversight, and it was too late when I realized that we should have actually involved them. They were involved indirectly, but apart from that, the information, the technical information, there was something about masks initially. When it came, you hear one expert saying, wear the mask, the other don't wear the mask, will. And I waited, but still I think I was not very strict initially with masks, again, because the informations were so conflicting. And luckily, we picked up quite early in the course of the pandemic. And I think it's Eid al-Fitr or Ladha. We had only complete lockdown in the last Eid of the pandemic, not this year, of course. But one of the Eids, I regret that we did not also have a complete lockdown. Because unfortunately, and this is you cannot change, part of our culture, which I admire, communication with the family, getting together on Eids. And people overdid it. And I know after any of these religious events, which I'm not blaming the religion for, it's the way we behaved, there was a surge of cases.
I see.
And it was very clear that it was because of huge gathering, not wearing masks, not keeping your social distance. So I will sit down one of these days and I'll put things on paper. I'm not going to call it a book. And I think Corona is going to have... Are
we not committing to the idea of a book just yet?
The pandemic will have probably the largest chapter. But I think it needs to be documented. The lesson learned need to be known. The opportunities, which also Corona created. We started virtual clinics for the first time in Oman. We had a drive-through pharmacies, the Royal Hospital. We have these conferences, Zoom and other media, which we never thought about before the pandemic. There are lots of things actually.
Lots of lessons there.
Yeah, innovation basically was driven by this pandemic. Are we going to have short-term memory as usual and forget all about it? Or are we going to build on it and make things better? I hope it's the latter and not the first.
Inshallah. Your Excellency, where are we today with COVID?
That's a very good question. That's somebody else's responsibility.
You're done.
No. Listen, I think in any profession, even when you leave the post, even when you think it's over, it's never over. I'm following what's happening still worldwide. And unfortunately, one of the countries which having huge surge of cases now, China.
Right.
And it's not over yet. What I hope and pray that any mutation or any variation of COVID-19 or COVID virus will make it weaker and milder. And that's...
Is that the trend that we're noticing?
Yeah, that's the trend. And that viruses do mutate or do change a lot. And it's not always that they change for their advantage. Luckily, most of the time, for their disadvantage. They need us to survive. And sometimes they get it wrong. Most of the time, alhamdulillah, they get it wrong. So it's not over yet. But I'm always an optimist. I hope the worst is over. I hope the worst is over. The vaccines helped a lot, regardless of all the rumors and misinformation. And I think also the public awareness worldwide has increased. A friend of mine was in one of the Far East countries, and he was telling me the majority were still wearing masks. The culture there, even before Corona, wearing masks because of the pollution, I think, protected them actually from many viruses and many infections. And in the first year when we started wearing masks in Oman, and second year, the number of cases of the seasonal influenza dropped significantly.
Yes.
So the Corona pandemic taught us a lot. Is it over? Honestly, I would say not yet. Is the worst over? For me personally, yes, the worst is over.
But then we can never predict what's going to happen tomorrow.
Not only that, unfortunately, pandemics are going to happen again and again, whether we like it or not. These viruses are so clever, and they modify their way of invading our bodies to survive. The lesson is the preparedness, and that is what I said. We had a good surveillance team. We prepared before the storm, and that's why we did lose lives. There was lots of damage, but the damage was less than what it could have been.
Us in Oman, before this huge, massive event of COVID-19 taking over the entire world, we ourselves here in the country had our own crisis. On January 10th, 2020, our grandfather, founding father, Sultan Qaboos, Allah yarhamu, passed away. Now, you being the Minister of Health, I'm sure you were involved in some capacity. So we're going to go out on a quick break, but when we come back, we'll talk about that.
This is Oman FM.
And we're back with this Oman FM special with His Excellency Dr. Ahmed Al Saidi, former Minister of Health. Thank you so much for joining us today.
Thank you again, and I'm delighted to be with you.
We're going to talk about a historic moment in the history of our country, Oman, and that's the passing of Sultan Qaboos, Allah yarhamu, which took place on the 10th of January, but the entire nation found out on the 11th. I still remember, and I'm sure every Omani remembers what they were doing when they found out that news on that morning. I remember the skies were weeping for his loss. It was gray. I was sitting at home, turned on Oman TV, and saw all of it as it unfolded, and it was devastating. And it's a devastation like I've never felt, and I'm sure no one has felt before. You felt an entire nation mourn. Do you remember where you were?
Yes, I do, and I remember every second details. And as you said, it was a devastation. It was a moment that even if you tried, you would never forget. And I remember my youngest daughter, when she knew the news like the rest of you on the 11th morning, she couldn't stop crying either. And he's Oman. He built the new Oman. When he came, I remember I was born before the Renaissance. And one of my topics I talk about now when I go internationally is how Oman's healthcare sector and other sectors for that matter were before 1970. And that attracts so much attention. So Allah yarhamu, he came or he took over when Oman was in the dark ages. That's what my daughter was saying. Oman, when I tell her how it was the dark ages. And within 50 years, he built a country that we became modern, and we became very proud of it. There is a Human Development Index, which is known internationally, and Oman was the fastest in that index for many years. And he started, as I said, where there was nothing. Our death rate in Oman for infant, that's newly born, and children below 5 was one of the highest in the world.
Right.
25% of Omanis who were born before 1970, before the early 1970s, 25% of them will not see their 5th birthday.
Wow.
i.e. they'll die before the age of 5. Many mothers used to die during labor because there was no healthcare facilities. And the life expectancy for us in Oman at that time was 49 years for men and 50 for women only. Today it's 77, 78 plus. We had not more than 12, 13 doctors in early 1970. Today we have more than 10,000. I'm talking about healthcare because that's my passion and that's the numbers I know. But if you take any sector, it was zero. So Allah yarhamu, with the team around him and with his unique leadership, which is a school for anybody who wants to learn about leadership, he managed to do all that in a limited period of time, and initially in a very sort of troubled area. We had the conflict in the southern part of Oman, and the resources were limited. But through his leadership, through his determination, through his choice also of people around him, I think he sailed us through a very, very difficult time to reach a place where we are very, very proud. And he continued to work till the last minute of his life, Allah yarhamu, and he was still giving the country all the energy he had. And I don't think, honestly, I can think of any leader in history, in the history of mankind, that I've read about, who did for the country, for their country, what he did, Allah yarhamu, in that limited period of time.
And who was as beloved as he is.
Absolutely. And not only by Omanis. That's also, I mean, you all remembered when he, Allah yarhamu, passed away. And I remember we were in the Grand Mosque for the prayer. Actually, the number of expats who were in the expatriate, who were in the street, who were in the mosque was huge. And it was genuine. It was not something that they were putting on. It was genuine. So, no, he is a unique character. He was, Allah yarhamu, a unique character. He dedicated his life to serve his country, to build his country, and to make sure that Oman definitely join the 20th century. We have a long history in Oman, and this is also something which unfortunately many people outside and in Oman, they don't know about it. And we had a legacy, and he was with his team working to return that legacy of Oman, our position, our history, our people. They reached places where nobody else from the region did. And we need to remind ourselves that we are not 50 years old nation or 52. We are thousands of years, but there were times, unfortunately, where we were not doing great, we were not doing well. And I used his leadership, Allah yarhamu, as an example that how one person with good leadership can change a nation and impact the world. And that's what he did.
In the last few years before his passing, the entire nation became aware of his deteriorating state. Perhaps we didn't know a lot of the details, and probably for good reason. But I'm curious, and of course, you can say only as much as you can say about your involvement, because I didn't consider this before, but obviously the Minister of Health of a nation would be also responsible for the health of the leader. So how are you involved?
As you said, It's a long story, but I will highlight certain parts of it. To start with, Allah yarhamu, when he found out that he needed further medical investigation and possibly medical treatments. I remember I was also abroad. I was in my summer holiday and I had a phone call at the time where I was, which was in Ireland. It was, I think, about 4 in the morning. And actually, I knew before I went in the holiday, and I said to my family that I might not complete this holiday with you.
You suspected?
I suspected something would happen. And of course, the concerned government agencies contacted me, and I came back the next day. I was here, and I was told that Allah yarhamu, he wanted everything to be done in Oman, which was for me great news. His faith in the healthcare system and in the staff in Oman. And I was delighted, but also on the other hand, I had some reservation because it's not the facilities, it is not the doctors, it is not the team. And if we didn't have the whole team, I could have brought doctors from the best centers in the world. But if things were done here, all of them, all the investigation, everything, I think knowing how popular Allah yarhamu with the public, whichever hospital he was in will not be accessible to the public.
I see.
And I suggested to him, rahmatullah alayhi, that yes, your order is definitely going to be I'll implement it, but I have 1, 2, 3 reservation. So he agreed, rahmatullah alayhi, to go abroad. And what I've learned also, which I knew, but I highlighted it actually publicly, the team of doctors who joined us in that journey from Oman, they were actually the decision maker more than the other team were looking after him. And I trusted them more and more because they were so knowledgeable. And we had so many meetings and debates with the team which were providing, and they were a wonderful team, by the way, in Germany, providing the care. But I was, it's not my field. I was there listening to both sides. And honestly, the knowledge and the experience the team from Oman provided, their counterparts in Germany became very impressed, and it was a joint effort. We were providing the health, the treatment, the management jointly. It's not one side against the other. So that took me back to Allah yarhamu, his decision to have things done in Oman. Technically, we would not have had any problem, but my reservation was about other issues. One of them I've mentioned. Let's say he was at the Royal Hospital, which is the largest hospital in the country. It is the tertiary care for the whole country.
Yeah.
Of course, the University Hospital, the Armed Forces, they are providing service as well. But that hospital, unfortunately, I know the Omanis will come and they'll be camping around the hospital.
Right, yeah.
So the journey was not without hiccups, was not without difficulties, was not without complications, but also we overcome this complication at that time because of his determination to get better. And he was determined to get better, and he did get better. And honestly, the doctors who were providing the health care, they were surprised how strong mentally he was. And this is a lesson also to all of us. Physical health is very strongly related to your mental attitude. His mental attitude and his aim was to recover, to get better, to come back and continue leading the country. And that's what happened. We left at 2014, and Allah yarhamu, he passed away on the 10th of January, as you said, 2020. So that's 6 years later. People with the same condition or similar conditions, like Allah yarhamu, Sultan Qaboos, most of them, they don't last that much time, and they cannot or continue to perform their daily duties. So he was a unique character in every sense you look at him. And I was very, very privileged and delighted to serve him and the country under his leadership, as I am proud and privileged of His Majesty Sultan Haytham, who luckily, alhamdulillah, also I served the country under his leadership for 2 years. But the story about his trip abroad or trips abroad, there are very painful moments that I've been through, and not only me, I'm sure the whole team who were with us, but there are also very joyful moments that we remember and we witnessed. So it's a mixed feeling.
Wow, thank you for sharing that. From a personal standpoint, it is comforting to me to know that he fought and that he had the strength to keep going, and he wanted to keep going, and he wanted to serve. I didn't know this before, so thank you for sharing that. I'm trying my best to not be emotional as we proceed with the rest of the interview.
We are human after all, so, but no, it's a story, honestly. His story needs to be, his leadership story needs to be taught to us, to the Omanis, the younger generation Oman. And I think it is just right that those who were born after 1970, they should be given glimpses or information about how things were before 1970, how we were living, those of us who were born before 1970, how much suffering was it to go abroad for schooling because there were only few or two schools in Oman. How much suffering to see somebody dying of a snake bite in front of you because there were no healthcare facilities. Malaria was killing thousands of people. So whichever angle you look at Oman before his leadership, it was not the dark ages, worse than the dark ages. And within no time at all, it's lifted up to where we are now. And I know some people are not happy with certain things, and that's human nature. And we cannot please everybody, as whether a government or any organization. But just if we reflect and look, where were we for 1970? Where are we today?
Context matters. Context is
absolutely.
Everything. Yeah.
And it was not easy. The income was limited. The conflict on the far was still active. The region we are from, the Middle East, is always in conflicts as well, which has affected us whether we like it or not. Alhamdulillah, the consistency and the transparency and the moderation of Oman's politics, not only politics, made us very popular worldwide, but it's not without also tremendous pressure to join this side or that side. And His late Majesty avoided that, Sultan Haytham Allah Yahfadhu avoiding that. So there are so many things that we should be proud of as Omanis. So many things.
12 years in service. When I'd wonder if you spent the last 6 months reflecting back, because it's a long time, 12 years.
There are few dates that you'll remember forever in your life, and some of them like milestones, some of them, why did I do that at that date? But I was appointed as an undersecretary on the 4th of December 2008.
Yeah.
And
you didn't spend much time there.
I was a year and a bit there, and then 3rd of March 2010, before 2011, I was also appointed to be the Minister of Health, which honestly, it was like a shock, but in a way, I expected a bit of it, but to absorb it was not very easy. And of course, I worked in the Royal Hospital all my career lives when I came back from my studies abroad, and I progressed in the field of both clinical and management, but I was never prepared to what's coming. Then unfortunately we all in very sort of painful way we remember what happened in 2011. So that took the few months of early 2011, they took our energy and effort and derailed us from the plan of the Ministry of Health. But luckily, we recovered quickly, and we've learned lessons also from that. And then we, with the team, started concentrating the Ministry of Health, and my priority was human resources. Because without well-trained doctors, nurses, other healthcare staff, buildings, machines are useless. And that's my strong belief. So we concentrated on sending our doctors, nurses abroad for further studies. We strengthened the Oman Medical Specialty Board, and it became internationally recognized. And alhamdulillah, today, if you go to any of the government hospitals, the top consultants and the best consultants are Omanis. And this happened over the last 10, 12 years. It was not easy either. Also, the first time we introduced liver transplant was after I took over, and bone marrow transplant. Kids were dying because of bone marrow failure. We didn't have the enough capacity to do it in Oman. So we started doing this, and I not intentionally delayed projects, but the projects were actually my second priority. And alhamdulillah, before I left though, there were 3 major hospitals which are under construction now. Sultan Qaboos Hospital, the new one in Salalah, which is over 700 beds. Suwaiq Hospital, which is about to be ready, 200 beds. Khasab Hospital, which is over 150 beds, also about to be ready, plus 3 other hospitals. We had the plans. We had a plan actually to complete the hospital structures in Oman before 2020, but the event that happened between 2010 and 2020, I think if anybody is fair, they will realize that not because we didn't want to or because we were not ready. The plans and the design were ready. And the last 3 hospitals, Allah Yahfadhu, Judge Sultan Haytham approved, are also now in the pipeline. So the structure of healthcare in Oman, as far as hospital goes, is actually going to be completed within 6 to maximum 8 years, I would say.
Inshallah. And as we're coming to the conclusion of this conversation, I have 3 questions that I'm going to ask you. So perhaps they don't have to be all that long of an answer, but maybe they are. The first is, reflecting back at your 12 years, what is your favorite memory? I know that's a tough one, but something that when you think back to brings a smile on your face.
Dear, there are quite, I think, few of them. One of them coming back to Oman from the first journey of His late Majesty's treatment. That is, of course, one of the latest ones. The second, for me as a physician, and that's what I want to be known as more than minister or ex-minister. I'm Ahmed, then I'm Dr. Ahmed. These are the things that are lasting.
At this point, I don't know if your dream will come true. People will always know you as the guy who got us out of trouble.
Well, with the help of everybody. But also the success of both liver and bone marrow transplant in the country, and establishing the service of liver transplant in Oman. For me, that's a turning point. That's for me, saving people's life is, you cannot put a price on that. It's very, very joyful. There are a few others, but now I'm thinking, you put me in the mood of...
A little bit of a spot.
No, you put me also in the mood of stressful life, but I'm sure there are many moments where we were happy. The Oman also positioned internationally. I was, in 2017, I was elected, and I was the head of the WHO World Health Organization Assembly for 2017. 194 countries. This Dr. Ahmed Al Saidi from Oman was the chairman of the organization for a year. That was a highlight moment for Oman, not for me,
absolutely.
For the nation. The regional office of WHO, which is based in Cairo, I chaired the committee for not continuously, but for about 4 times, which is also unheard of. I managed, with the help, of course, of others, but I managed to get the first ever regional director for a United Nations organization, which is WHO, in Cairo, and not only managed to have him the director there, but he is praised by every country now in the region and internationally. One of my, Dr. Ahmed Al Maawali, who is an excellent Omani person and a physician. Also, when I was elected the chairman of the higher committee of the Arab board, that's the board in charge of training all the Arab doctors postgraduate, I was elected 2018. That's of course after also I pushed a name from Oman, and this election, it's not like Wasta. Dr. Umar Al-Rawas, Professor Umar Al-Rawas, he was elected from among 7 candidates to be the general secretary. So at one stage, the regional director of WHO was Omani, the head of the higher committee of the Arab board is an Omani, and the general secretary of the Arab board was an Omani. This is soft power for Oman, and this came because of, alhamdulillah, the good communication and connection with everybody else, and because of Oman's politics and policies. People always trust us, and I hope that will continue.
That is
so
very
these are a few of the highlights.
That is very impressive, mashallah, mashallah. And on the other hand, we know that you faced many challenges throughout your term. And perhaps it is unfair to ask you which one was the hardest on you, but I will ask you anyways, and I don't know if you have an answer for that. Which one, at least from an emotional level, got a hold of you?
I think, like everybody else in the country, the death of His late Majesty, that was something that you cannot describe. The pain, the stress, the sorrow that you've been through. That was one of the probably most difficult. There are many other ones. I lost my mother when I was in Germany, so it's so there were quite few, but I'll remember too, and these are very, very painful, especially that you were away, but you were also doing surfing the country. Of course, Corona, the stress during Corona, I've already been through it, and I've mentioned it. But for personal level, I think these 2 events were very, very difficult.
And finally, what now? Well, now that you have retired, and I can obviously tell from this conversation and also from your previous interviews that you've done, you're not ready to stop. I don't think you will be sitting around for very long.
Well, I've committed myself to have rest for 4 to 6 months. The 6 months are over now.
Now you're back.
Well, I'm back. There are so many options, honestly, but I'm limiting my activity for things that will serve Oman in the healthcare sector through a connection to international organization, through hopefully making things that we struggled for during Corona, like everybody else, having these things made in Oman, from the gloves to the vaccines. That's my dream. Stopping is not an option, because when you are used to being running every day, you cannot just go and sit down and watch your life go by. I believe retirement is to start a new way of life, but also you need to repay the debts for your family, your friends, and of course yourself first. It's not a secret that during the post of 12 years, lots of compromises, and the compromises usually the first affected are the family and your friends, and of course your health. I started luckily exercising during Corona, actually. Exercising by me, I mean walking. But my weight went up. I didn't feel as strong as I am now. So the plan is to look after myself, the family, friends, but of course continue to give the country all my effort, all what I can do to basically maintain and continue the progress of healthcare in Oman. There are certain posts which even if they are handed to me on a golden plate, I would say no. And one of them, I'm under tremendous pressure from my colleagues in the region internationally to be nominated to be the WHO director, which is in Geneva.
Why not?
Well, that's a good question. Why not? That's because I've done my share of 9 to 5 jobs, firstly. Secondly, I'm actually optimistic that we have an Omani who's working at the Ministry of Health at the moment, and she will be ready for the post, and she can do it. And I'm already lobbying for her internationally. She's an amazing, like many of our Omani ladies, or all of them.
Are you allowed to say who that is?
The name I will not mention on the air,
enough.
but she would know who she is, and she have also a very supporting husband. So I'm optimistic that the next director of WHO, if we work from now and the election after 4 years, it will be an Omani, and it will be the first from our region, WHO region, which is called Eastern Mediterranean region. So I'll continue to work on that, and then you'll be the first to know.
I really do appreciate that.
Yeah.
I think I speak on behalf of every person living in this land by saying thank you, genuinely. I'm grateful, and I'm speaking from my personal point of view as well. I'm absolutely grateful for you serving the way you did, and for you accepting this invitation to be here today. It's quite an honor for me.
Thank you very much, and I can't tell you how proud I am to see you young Omani talents in these positions. And countries are not built by steels and bricks, they are built by people like you. And I hope the younger generation will continue giving Oman what it deserves. So thank you very much.
This is Oman FM.